Is there a test to diagnose osteoporosis, doctor?
Yes, there is. It's called a bone density test, or a DEXA scan, and it is a painless, non-invasive exam, similar to an X-ray, that can help us determine your bone density status.
And that's it right there?
Yep, that looks like it right there.
All right, so this kind of does what? Can you explain to us? Takes about how long, so people can know it's effortless?
Yes, it's effortless. It is like an X-ray machine. You can wear your clothes. Of course, it will detect any buttons or metal, so you may be asked to wear a gown, and it does not require any preparation. You don't need any intravenous medications or sedation. Generally, the test takes about 15 to 20 minutes, and like I said, similar to an X-ray.
All right, so a lot of people probably have these kind of questions, so let me just start asking them because I started jotting them down. You need a prescription?
You do need a prescription for most places to get a bone density scan.
What age do you recommend one, doctor?
So the age recommendations, there are some guidelines. Generally for women over age 65, for men over age 70, and you may need it at a younger age if you have certain risk factors, which I know we're going to be discussing a little bit later.
Is there a lot of radiation here? Sometimes people want to know that.
That's a great question. It's actually considered low radiation, equivalent to basically your atmospheric exposure on any given day.
And when do you recommend a follow-up when you first start?
So generally, the DEXA scans are done every 2 years.
All right, and I know hospitals like Baptist offer what they call heel scans. Can you tell, free for that matter, can you tell us what those are, and does it replace a bone density test?
That's a great question, and I actually get that question a lot from patients. A heel scan is a type of screening test that's offered at a lot of health fairs and by a lot of employers, and by our healthcare facility as well. And it is a good screening test to find out if this is something that you should discuss with your doctor. It does not replace a DEXA scan, which is a central exam and more complete. But I am in favor of the heel scans because it does allow for patients to start to have a conversation with their physician.